Hey guys, welcome back to Scanning the Mind. On this week's episode, we've got another medical journey for you. Today we welcome Dr Sharma, who is a rheumatologist, and not only that, she is also Varun's wife. So Seema, I don't think a lot of people really know what rheumatology is or what a rheumatologist does. Can you kind of clear that up a little bit for everyone?
I mean, that is fair. My mum doesn't know what a rheumatologist is still. Rheumatology is all really about autoimmune diseases, the study of multi-system disease. So you get all of those diseases like lupus and rheumatoid arthritis that can affect pretty much everywhere. And that's what rheumatology is. If the focus a lot is on musculoskeletal diseases purely because a lot of the disorders that we look after can predominantly affect the joints. But it's mainly about autoimmunity.
So all the stuff in med school that you just cut because it's too hard.
Yeah, there's a lot of things like vasculitis that you just sort of skip over because there's too many types.
Yeah. So for all the people out there that want to become rheumatologists, how do you get there?
Essentially, you go to medical school, so you do your 5 or 6 years depending on where you go there. You do Foundation 1, Foundation 2, and then you'd have to do what used to be called medical training but has now changed over to IMT. During that time you have to get your MRCP, so Part 1, Part 2 PACES, and then you apply for rheumatology. It's 5 years because you have to credit in general medical as well, so GIM training as well. Then you're a consultant rheumatology.
There must be a lot of things that you really enjoy about doing it to last 14 years.
I think it's one of those specialities in medicine that still affects everywhere. So I like multi-system disease. I think if it was me personally, I'd get bored of things that just affect the lungs or the heart. No shade intended to respiratory physicians or cardiologists out there. Because it can affect everywhere, it keeps it interesting. Rheumatology is all about the art of diagnosis, really. So you get those patients that a lot of people haven't managed to diagnose. For example, some joint symptoms, some respiratory symptoms, some odd neurological symptoms sometimes even, and you're the one that gives them that unifying diagnosis when a lot of other people have failed. So the way I describe it to medical students is, if you remember watching House, rheumatology is a bit like House in the sense that you are trying to find that one thing that holds everything together.
Seems like you guys are the people that other specialties turn to when they don't really have a clue what's going on. Yeah. Would you say that's quite accurate?
Yeah, I'd say so. So if you've got patients on the ward and they've got these random symptoms, their inflammatory markers are raised and no one really knows what's going on, or they've got a temperature of unknown origin and antibiotics aren't working, we're the speciality that a lot of the time people turn to. The other thing is that because it affects every system, you do actually use your clinical skills in comparison to a lot of specialities. With rheumatology, because you don't know where it's going to affect and what symptoms people are having that even they don't necessarily know they're having, you do have to do a full systems examination. So that's why rheumatologists often pick up signs and fit everything together. The other advantage is a lot of the patients, because they're long-term conditions, you do get to know them quite well. So you'll have people who've been coming to your clinic for 20 years with their rheumatoid arthritis. You've seen them try out different treatments. So if you do get that connection with patients that you don't necessarily get in other specialities. Rheumatology, compared to a lot of the other sort of diagnostic, very cerebral specialities as well, I would say that we can offer a lot more treatments compared to perhaps some others. So if you've heard of all the different biologics, all the different MABs that keep coming out, rheumatology is really at the sort of, rheumatology and oncology to be fair, at the forefront of all of that. So previously, even 10 years ago, where a diagnosis could completely change someone's life, now people are living absolutely fine with all these treatments. And it is satisfying to be able to not only diagnose someone but say, we're going to be able to make you better. Because they're really complex diseases, diagnosis means a lot to a patient. So imagine being 10 years or so, sometimes even, you've no idea what's happening to you. None of the doctors that you've seen have any idea what's happening to you, and finally you at least can predict what might happen to you.
So you speak very passionately about rheumatology, and it sounds like you love it, and there are lots of good things about it, but there must be things that you hate.
So the problem with any outpatient speciality is that you do have a lot of admin, and I think I really underestimated how much admin there was involved in such a speciality. Because rheumatology often is sort of the end of the line in terms of, well, we don't know what's going on, who else we can refer to except for maybe immunology. You really need to be confident that you've exhausted all your options and at least got them seen by the right people, and that means a lot of admin in terms of looking through every single investigation they've had, all the trends of everything, looking through all their investigations. So that's why I think the admin-wise it's quite labour intensive. And because they're on biologics things for a long time, you end up with a lot of monitoring requirements as well for those patients, and all the problems that come with that will also get referred back to you. So if people's blood count goes down because they've been on methotrexate, can they still have the methotrexate? All of those sorts of questions come to you. We do have amazing specialist nurses who take over a lot of the drug monitoring for us, which really helps them do all the drug counselling as well. So we don't have to do all of it, we're not alone in it, but it is admin heavy.
Anything else that you don't particularly like?
I suppose with the way training is now, with rheumatology you have to dual accredit in GIM, so you don't get, you used to get a choice in terms of do I want to do pure rheumatology or do I want to also be dual accredited in general medical training as well. You don't get a choice anymore, so a significant component of your training is dedicated to general medicine. And you can see that as an advantage in that rheumatology affects everywhere, so knowing general medicine is really helpful.
Yeah.
It does make you a better clinician, I'll be honest, but it does mean that some of your time is taken away from learning quite a complex field.
Okay, right.
So trying to keep your skills up in rheumatology and general medicine can be quite challenging, particularly if you put academia on top of that as well. And it's quite nice that it's varied in a lot of ways, but sometimes it can be quite tiring to try and keep up with each one.
And I imagine you have to put like different hats on because you think very differently when you're doing acute medicine compared to when you're doing rheumatology.
Completely. If I thought like a rheumatologist on my general medical on course, I would discharge no one. I would see 2 patients.
Yeah.
Which the hospital would fall apart.
They still have this one symptom that I want to investigate. When did you realise that's something that you wanted to do?
So all the way through medical school, this is going to sound really nerdy, but my favourite lectures were immunology. I just thought it was so logical and so interesting how molecules and cells, and it translates into a disease, and I thought that was fascinating. So I used to want to be an immunologist.
Okay.
As I found out more about immunology, I realised in practice what you do tends to be a bit more, primary immunodeficiencies and allergies, which I wasn't as interested in. I liked autoimmunity. From there I thought, do I like renal disease or do I like rheumatology? In terms of what you do day to day, I felt that rheumatology was more for me.
What kind of advice would you give people that are looking to do rheumatology?
I'd say definitely do some work experience first, because it's not something that you get exposure to day to day. A lot of people have no idea what rheumatologists do.
I mean, you don't really do it in medical school.
If you apply for that specialty, that's what you're doing for the rest of your life. So I'd say get at least a week work experience with a passionate consultant who likes teaching, and that's where you'd really get the best exposure to rheumatology. You have to look at what the consultants are doing in terms of making your career decisions really compared to what you're doing like as you're more junior. Also, I'd say even if you didn't want to do research all the way throughout your career, having a little bit of research background is important. A, it helps when you're applying, and B, rheumatology is a very academic speciality in the sense that your treatments are changing all the time. So having some research there shows that you're passionate about keeping your knowledge up to date and trying to take things forward.
So yeah, thanks for coming on, sharing all that with us, and obviously everyone watching. I think this video is going to do very well with what you've talked about and how passionate you appear about it. If you guys have any other specialties that you want to know about, leave a comment down below. But otherwise, we'll see you in the next one, hopefully with Varun back.